anti-D injection for fetal-maternal hemorrhage and sensitizing events in pregnancy being continued. Termination of pregnancy, medical and surgical, spontaneous and incomplete abortions, and complete abortions, and bleeding before 12 weeks of pregnancy approaching to 12 weeks, then ultrasound needed to confirm it, and complete miscarriages, and the instrumentation and amniocentesis, the sensitizing, the amniocentesis, fetal blood sampling, and chorionic villus sampling also require anti-D, and antepartum hemorrhages, and instrumentation, and this closed abdominal injury, and this intrauterine death. All these sensitizing events before they need to have anti-D sensitizing for the sensitizing events, and they must be given before 20 weeks and after 20 weeks in the larger doses like 1500 international units. And these counteract these anti-D, they counteract this maternofetal hemorrhage and the sensitizing events by red cell, counteracting red cell FMH, and for that Kleehor Beckett test is also needed to detect how much fetal-maternal hemorrhage occur, and additional doses of anti-D should be given. They are given intramuscularly, and if there is a patient of that needs having thrombocytopenia, then they should be given subcutaneously. IV also preparations are available which are given in RHD positive blood, and for that, if exchange transfusion RHD positive blood more than 2 units of blood, exchange transfusion should be done. They are used for therapeutic and practical purposes, and they are also used for RHD negative platelet transfusion. If RHD platelet positive transfusion is needed, then 250 units of anti-D should be given after the every 3 platelet doses. And as I have told that we have to detect flow cytometry to detect hemoglobin and these red cells, and rosetting technique also used, and so these are used. Fetal-maternal this anti-D is used within 72 hours, and after 10 days there is some protection is given, and after 20 days all the protection is lost. So this anti-D is used to detect, is given for the allowing immunization from the fetal-maternal hemorrhage resulting from RHD negative mother with having a RHD positive child, and has to be given 12 weeks before 20 weeks, 12 weeks, and after 12 weeks 1500 international units, that is 300 microgram, given intramuscularly or subcutaneously or IV. So they are used for therapeutic and non-therapeutic, prophylactic and therapeutic. Doses are divided and undivided, and then all these for the detection of, and Kleehor Beckett test is needed to detect the fetal-maternal hemorrhage for additional doses of anti-D. This is to be given in termination of pregnancy, in complete abortion, instrumentation, chorionic villus blood sampling, intrauterine death, closed abdominal injury, and any other sensitizing events, in even in stereoscopically, if the for the embryo transfer, and for any removal of any submucous fibroids or any instrumentation done in the intrauterine. So this is a very important anti-D subject, and has to be given for any pregnant woman who is RHD negative and having RHD positive, so that in the next pregnancies no sensitizing, even as the IgG they cross and they bring about this allo immunization and this resulting in rhesus incompatibility resulting into hydrops fetalis. So we'll be reviewing this again. This is a CME conducted by the Mother and Child Survival Group by Dr. Tariq Masood Khan, gynecologist at a district setup, and takeaway message is pray, praise, trust, love God Almighty and follow Rasulullah sallallahu alaihi wasallam, our health and survival. And we must not forget our glorious past. Subhanallah wa bihamdihi, Subhanallah al-Azim, and Allahumma ajirna min an-nar, save us from fire of Jahannam, and donim unki ठोकर से सहरा और दरिया सिमट कर पहाड़ इनकी हैबत से राय, और दहर में इसमें मोहम्मद से उजाला कर दे. कीप अप द CME पोस्ट ग्रेजुएशन, वमा अलैना इल्लल बलाग.